In this video, I'm going to show you all the changes coming to Medicare Part B in 2023. And then I'm going to show you how to avoid the common mistakes that people often make in Medicare. Now, the changes coming to Medicare Part B are actually twofold. We're going to see some changes for 2023 as it relates to the Medicare Part B premiums. Now, for almost all people, Medicare A is $0, but B this year is $170.10 a month. If a person's on Social Security, that Part B premium comes out of their check. If not, they're either billed quarterly or they can set up some kind of electronic payment to Medicare to pay their Part B until they start their Social Security. Now, we do not know yet exactly what the Part B premium is going to be. There's a lot of speculation that it's either going to remain the same or actually go down a little bit. Because what happened every year, Medicare has to estimate what they believe the overall healthcare costs are going to be for the coming year. And so as we moved from 21 to 22, year 2022, they overestimated that because of the Alzheimer's drug Adulam. Number one, the cost of that medication came down and it wasn't used as much as what they thought it would be. So they really did overestimate. And that's why we saw the Part B premium move up so much in 2022 to $170.10 a month. Now, again, we don't know what it's going to be, but some believe it could come down maybe $8 to $10. So we're not sure, but we are expecting some type of adjustment. But I do want to clarify how this Part B premium is calculated because there's a lot of confusion about that. So the way we determine what our Part B premium will be is based upon what's called the modified adjusted gross income. So if I'm on Medicare in 2022, the government's actually looking back at my 2020 modified adjusted gross income. If I'm going to be on Medicare in 2023, what are they doing? They're looking back at 2021. And so the modified adjusted gross income is nothing more than your AGI plus any tax-exempt interest. Typically, municipal bonds you don't pay any taxes on those, but you report that number on your federal return. So they take the AGI plus the tax-exempt interest, and the sum of that number determines what you pay for your Part B. And so if you're a single filer, the numbers are here. If I make $91,000 a year, modified adjusted gross, or less than that, then I'm going to pay the $170.10 a month. If I'm a married couple and I'm $182,000 as a joint filer, again, if we're below that number, we pay $170.10 a month. But those people that are going to be above that $91,000 as a single filer, $182,000 as a married filer, then what happens is they're going to pay more, and those additional amounts are called IRMAs. That stands for Income-Related Monthly Adjusted Amount. And those can range anywhere from about $80 a month upwards to about $500 a month, depending upon your income. Now, you're going to have to be making about over $750,000 a year to be at that higher level. But the point is, people that are above those amounts are going to pay more for their Medicare Part B as well as their drug plans. All right, those are called IRMAs. Now, if I have a life-changing event, I retire or semi-retire, and my financial situation changing, then I can always appeal the IRMAs, and we can see those dropped off. But that is one thing that we're still waiting for, the final number for our Medicare Part B premiums.
Hey, if you're on Facebook, you really need to join our MedicareSchool.com Facebook group. And the reason I say that is you can go inside that group, and every day, my dad and I are monitoring that, and we've got a couple other people on the team, but you can go in and ask your questions. And then every Monday night, we actually do a Medicare Monday, where Marvin or myself breaks down one important topic or one important part of Medicare and just explains it to you live. You can ask questions, all that sort of good stuff. So go ahead, look up MedicareSchool.com on Facebook, join the group, and you won't be disappointed.
Now, the second change that is going to go into effect January 1, 2023 has to do specifically with enrollment periods. Now, when we're talking about enrollment periods, this all has to do with starting Medicare. And so this is for people that are going to enroll into A and B. There's going to be some changes that will occur in 2023. Now, to really understand enrollment periods and to make sure that you don't make a mistake with them, you have to realize there's actually 3 different enrollment periods to get into Medicare. They are given an acronym, IEP. The second one is SEP, and the third one is GEP. Now, this IEP actually stands for Initial Enrollment Period. The next one's called Special Enrollment Period. and then the other one is called the general enrollment period. All right, so these are our three opportunities to enroll into Medicare. And so there are going to be some changes to a couple of these. So the main thing I want you to get from this is that you want to be sure that you don't make a mistake by using the wrong enrollment period. So let's talk about these enrollment periods. The first one, of course, is called our initial enrollment period. Now, that initial enrollment period is for people who are starting Medicare A and B at 65. All right. And there's people who have to start at 65. In fact, anyone that is approaching 65 and they're covered by a retiree plan, or they're approaching 65 and they're covered by a COBRA plan or an Affordable Care Act plan. They went through the healthcare exchange to get an individual plan, or they're in an employer plan of theirs or their spouse's, but there's only 19 or fewer people on the payroll at that company. That's called a small group. So again, retiree coverage, ACA coverage, COBRA coverage, and small group plans, 19 or less on the payroll, you have to start Medicare at 65. You have no other options. And so if we have to start at 65, we are using this initial enrollment period. Okay, now here's the way it works right now. The initial enrollment period lasts for 7 months. Okay? Now this year, let's suppose someone's birthday, let's say their birthday is in November, and they could start Medicare in November 2022. Okay? So what happens? They have 7 months. That's 3 months before they turn 65, the month they turn 65, and 3 months after. And this 7-month window is the time in which they can enroll into Medicare with no penalties and no problems. So here's the timeline on this. If someone enrolls, in this example that I'm showing you, the first 3 months prior to turning 65, if they enroll into Medicare A and B, then their coverage starts November the 1st, 2022. But if they don't enroll into Medicare until the month of November, now their coverage is not going to start until December. All right. But if they have a birthday in November of turning 65 and they enroll in December, then their coverage won't start until February. If they keep waiting, what happens is the government keeps putting off their coverage in the present system. So if I enroll in December, I'm going to start in February. If I enroll in January, they skip February, March, and now my coverage is not going to begin until April. If I enroll in February, now my coverage won't start until May. So what's happening in the present system is if I enroll my birth month thereafter, they are delaying my coverage. Okay, either 1 month or 2 months or even up to 3 months. But in 2023, the initial enrollment period is no longer going to work that way. Okay, they've actually simplified it. And again, we still only have 7 months to enroll into Medicare at 65. But what would happen here, and let's go back and let's say I'm turning 65 in November of 2023 next year, all year long, and thereafter, here's the new rules. If I enroll my first 3 months, my coverage starts just like it would today, November 2023. But now what will happen if I enroll in November? What will happen is my coverage starts the next month. If I enroll in December, coverage starts in January. Enroll in January, coverage is going to start in February. If I enroll in February, my coverage will start during the month of March. So instead of them delaying my coverage for 1, 2, or even 3 months, now they're just going to start my coverage the following month. Now, keep in mind, I only have 7 months to enroll. So one of the mistakes that people will sometimes make is they will miss this initial enrollment period. And then if you do, then you're only eligible to enroll into Medicare during the general enrollment period. So my caution to you, really the warning is, don't miss this initial enrollment period. If you have to start at 65, this is when you're going to have to do it. And the month that you decide to enroll will determine when they're going to start you. Now, next year it'll be pretty simple because whenever you enroll beyond your birth month, it starts the next month. Right now, we're skipping more than just 1 month. It could be up to 3 months that will be skipped. All right, so the effective dates will be changing then for 2023. So that's the initial enrollment period. And again, anyone that has to start at 65, those are the 7 months in which you're going to need to enroll in the Medicare. Hey, just want to let you know real quickly that my son Joshua and I every week do a podcast, and it's called Retirement Real Talk, and we get into Medicare issues, but also Social Security and investing and all the things that really matter as you make these decisions about retirement. Hey, we'd love to have you join in on that podcast. It's every Wednesday. Anywhere where you listen to your podcast, you'll be able to find us. Now let's talk about the second enrollment period that some people will use, and this is called the special enrollment period. And this is really for anyone that did not start Medicare at 65. Why? Because they didn't need to. Because they or their spouse were still working, covered by an employer-provided plan that was a wonderful option versus Medicare. Now, sometimes people are working and will go on Medicare because their group plans are really not that great. But if the group plan is great and you want to keep that coverage, it is fine to do so. Remember, as long as that group has 20 or more people on the payroll, you don't have to do anything with Medicare. This plan could be yours, it could be your spouse's, and if you choose to be covered by the plan, the government is fine by that. But eventually, you're going to lose that plan. You're going to want to come into Medicare, and you could be 66, you could be 67, could be 72, whatever age, but you're beyond 65 now, and now you're ready to start your Medicare benefits. Your initial enrollment period is long gone. Remember, that was around your 65th birth month. So the special one will be the one that you'll use to come into Medicare. Now, the key to understanding this one is this. We have to prove creditable coverage. So if you do not start Medicare at 65, you're going to have to prove to the government that you have had insurance and you've been employed and covered by that employer-provided plan. So if I'm going to start Medicare at 67, we have to have credible coverage approved back to 65. If I'm going to come in Medicare and I'm 79 years old, I'm going to have to go back 14 years to 65. So we have to prove credible coverage back to 65. And the way that we do that is we have a form called the CMS form L564. And your employer HR department is the one that normally will fill this out, verifying employment and insurance back to 65. And so that L564 proves credible coverage. In addition to that, we have another form that we're going to use called the CMS 40B. So if I am coming into Medicare beyond 65 because I was still working or my spouse was, these are the two forms that are going to be added to the process. So the L564 proves credible coverage, and the CMS 40B is the form I'm going to use to tell Medicare when I want to start my Medicare plan. So let's suppose my group plan is going to end July 31, and I want to start my Medicare August 1st. What I would do is on the 40B, I would let Medicare know, please begin my Medicare benefits August the 1st. So we're actually picking the date. Now keep in mind, we never do this paperwork any sooner than 90 days prior than we want our coverage to begin. They will not process your application until within 90 days of that. So the employer verifies credible coverage, you fill out the CMS 40B form, and you submit those to the local Social Security office, and then you'll come into Medicare without any penalties, without any problems using this special enrollment period. But keep in mind, the special enrollment period is only for people that they or their spouse were working at 65 and beyond. If you're not working at 65, you or your spouse, then you have to use that initial enrollment period. So this is for those that did not start at 65. We're going to have to follow that process in using those two particular forms. Now that takes us then to the third enrollment period that is called the general enrollment period. Okay. Now this is one that most people are not going to want to use because with this one there's some penalties and there's some problems. But this general enrollment period is for those that made a mistake. They missed their initial, they missed their special or didn't have a special, and now they're going to come into Medicare. So the way this present system works, because this is 2022 and that's going to change in 2023, is this. Number one, the general enrollment period lasts only 3 months, and that's it. Right? And by the way, that's not going to change next year. And those 3 months are January 1 to March 31. So if I miss my initial or I miss my special, I have the first 3 months of the year to enroll. That's the same for next year as well. And so the way it works with this enrollment period for this year, if I enroll the first 3 months, then my coverage would begin July 1 of that year. So what they're doing is they're delaying my coverage. And every 12 months I went without coverage. Not only are they delaying that coverage, they're going to add a 10% penalty for life to my Part B premium. So if I go without 2 years, I got a 20% penalty, 3 years, 30% penalty, and I pay that for life. It's going to be added to my Part B premium. All right. Now, next year, what's going to happen in 2023 is I still only have 3 months to enroll, but instead of them delaying my coverage to July 1, what they will do is they'll start my coverage the next month. So if I enroll in January, they'll start my Medicare B in February. If I enroll in February, they'll start me in March. And again, if I start and do my enrollment in March, those are going to start me in April. So they're just going to put us off for 1 month instead of putting us off until July. Now, we still have the penalties, 10% penalty for every year that you went without Medicare. They're going to add that to your Part B premium. And so that's why we're saying we don't want to have to use a general enrollment period. We either want to start with our initial enrollment period at 65 or the special enrollment period if we come in beyond 65. This general enrollment period is just for those that made a mistake, coverage is going to be delayed, and there will be penalties. Now, there's two other mistakes that people often will make that I want to highlight here just real briefly. Number one, and that is for people that decide to have A and B only. Okay. In other words, they just enroll in a Medicare A and B only, and they don't get any additional insurance. Now, the additional insurance products that we can get are called supplemental plans, advantage plans, or drug plans, right? And when someone has A and B only, they put themselves at a tremendous amount of risk because Medicare A and B does not pay for anything 100%. Now, they will cover preventive services, but beyond that, if you go to the hospital, you see a doctor, you have a surgery, you have a CAT scan, you're going to participate in the cost of that. And it can be very costly, right around 20%, and there's no limit to that. So when people have A and B only, they put themselves at a tremendous amount of risk. And so when you first go on to Medicare A and B, you have this opportunity to be able to buy other insurance products. So if you miss out on opportunity, what's going to happen, you may be able to pick those up later, possibly, but now you're going to have complications. And so one of the big mistakes that people make is when they enroll in A and B, they don't realize that they have this 6-month window where they actually can qualify for any Medigap policy that's on the market. These are also called Medicare supplemental plans. And there's actually 10 different plans. But what you want to do is if you want one of these Medigap policies, 6 months of your B date, you can have anything that you want with no underwriting. So let's suppose someone's going to start their Medicare in July 1. What happens is they actually can apply for a Medigap policy 6 months in advance, and their coverage will begin July 1. But after July 1, now they only have 6 more months to have anything they want with no underwriting. So in my example, that would be July, August, September, October, November, December. So all the way up until December of that year, July to December, they can have any Medigap policy, no underwriting required. We call that a guaranteed issue right. You make the application, the company will approve that coverage. But in my example, beginning in January 1 of the following year forever, now we have to go through underwriting to get a Medicare supplemental plan. And so now you have to answer 25 to 30 health questions. We have to check all your medications, get a statement from your doctor. And so now if you want to get a MedSup plan because you just missed this 6-month window to get a Medigap policy, there's a possibility that that insurance company will deny you. If they don't like your health conditions, they don't like your pre-existing issues, then they don't have to give you coverage. And so what happens if you have rheumatoid arthritis, or maybe you're insulin-dependent diabetic, or maybe you have spinal stenosis, or AFib or AFib, or some heart issue going on, now that insurance company does not have to accept your policy. So people miss out on this once-in-a-lifetime opportunity to get any Medigap of their choice. And if you miss that opportunity, if your health is really poor, then you may never get one of those the rest of your life. And then lastly, there are some people that will enroll in A and B, and what they'll do is they will not enroll into a drug plan. In other words, they say, no, I'm not interested in a prescription drug plan. And again, I think this is a huge mistake. People do this because they look at their present situation and maybe they're taking no meds or maybe very cheap medications, and they actually maybe get those at a cash price better than what a plan could offer them. And so the mistake there is they're only looking at today. They're not thinking about 3 months or 6 months or 9 months down the road. And so what happens if you don't get a drug plan when you're first eligible to do so, you can get one at a later date, but you can only pick up a drug plan now October 15th through December 7th, and then those plans go into effect January 1. So let's suppose someone gets some serious health issue in March or April or any time prior to the open enrollment season, they are going to be out of pocket with all their financial costs for their medications because the drug plan is not eligible for them. So we can only enroll into a drug plan when we're initially coming into Medicare, or during the open enrollment season. So if you don't take a drug plan when you're first eligible and you want one later, we're limited as to when we can enroll them. And notice the coverage doesn't start until the next January. So if something happens to your health and you need expensive medication, you're going to have to beg and borrow and do everything you can to try to get the medication. So that's why I encourage all people to get a drug plan. Even if you take no meds, you can get an expensive drug plan. There's some as low as $7 a month. But that drug plan will make sure then that you're going to have very little out-of-pocket expenses for your medications. I have people that are on meds that are $7,000 a month retail cost. But because they have a drug plan, they're paying $350 a month for that $7,000 a month medication. And so you want to be sure that you don't make the mistake of going without a drug plan. Don't just look at today. You want to make sure we're aware that something could happen with our health. It could happen soon, and there could be some very costly medications that are needed. So don't make the mistake of going without a drug plan. Now keep this in mind, and I'll close with this. If you decide that you're going to get a supplemental plan, your drug plan will be separate. We call those standalone drug plans. It could be a separate company. It's going to have a separate premium and a separate policy. If you decide to go with an Advantage plan, some of those will actually include a drug plan as part of that package, all right? But either way we go, we want to be sure that we have some type of a drug plan, just in case we need some medication that's going to be expensive. Don't make the mistake of going without a drug plan. Then lastly, anyone that does not have a drug plan is going to be penalized, and that penalty right now is 1% per month for every month that you went without. 1% per month. Okay, and that is actually a lifetime penalty. So if someone goes without drug coverage for 36 months, they're going to have a 36% penalty added to their Part B, and that will be a lifetime penalty. The biggest risk is going without a drug plan, but secondly, having to pay a penalty if you want one at a later date.